Welcome back to Capital Today. My name is Racharya, and now we're going to enter our FaceTime segment where we're going to talk about the healthcare industry. As we all know, the saying goes, prevention is always better than the cure. And our guest today is someone who envisaged this importance with regards to diagnostics and in terms of doing reports with regards to before the illness becomes extremely serious. Today, we'll be interviewing Dato Beh Chun Chuan, the founder and chairman of BP Healthcare Group. Over to you, Shikin.
Thanks, Raj. I have here with me Dato Beh, who's actually from BP Healthcare. Thanks for coming in this morning, Dato.
Thank you.
Yeah. So, Dato, can you describe a little bit more about BP Healthcare to our audience so they actually have an idea about your company and also yourself?
BP is the initial of my name and my wife's name. B stands for Beh and P stands for Po. So I started BP Healthcare way back 1982, 1182. By end of this year, I should be 32 years.
Wow.
Yeah.
Okay. So back then, 1982 was a very long time ago. What inspired you to actually open BP Healthcare? Because it wasn't something, healthcare wasn't something that was really upfront back then.
Because I'm a trained medical microbiologist. And I was introduced to this job by my mentor, Tan Sri Dr. Jagadison. And I worked for this private laboratory. And from this, I was working for him for 14 months. And I did a management buyout in the year 1st January 1982. Well, so by this year end, I will be 32 years in business. Yeah.
Okay. And because healthcare is something was relatively new back when you started, what was the kind of challenges you actually faced?
Actually, at that time when I was in as a microbiologist, I was running the hospital laboratories, and it was very manual system in those days, and the volume of business was very small, and it's not that difficult. It's so routine until when the volume picks up, when the whole world we were actually healthcare is a global same global trend. It happens in States, England. It's also happening in Malaysia. So we were running at the same pace. From manual system to semi-auto and then automation. And in those days, we were running lab. We do all the manual system, and it was so tedious. And you can only do limited volume. Today, with automation, it's scalable, and you can do millions of tests a day.
Wow. Okay. So, well, your background is actually from a technology perspective. How difficult was it to actually go into business on your own instead of working for someone?
I was born in a business family, so I have the DNA of the business, of doing business, and I always coin this to all my new staff about Technopreneur. I'm one of those Technopreneur, from a scientist to be a businessman. And at the same time, while I was doing my business, I took up an MBA in early 80s. And with that MBA, it helped me how to read accounts and formulate all this strategy. Yeah. Okay. So it was not a difficult path.
Okay. Well, looking at healthcare, the road that you took was a bit more different from what most of the hospitals and healthcare providers did. Most of those private hospital healthcare are actually open in big urban areas like Kuala Lumpur, Penang, and Johor Bahru. But your approach was a bit more different, looking into Perak and then even Sabah, Sarawak. What actually triggered you to do that?
Actually, our company, BP Healthcare, it started from Ipoh. And while we were doing our services, and as I said, from manual, semi-auto, and automation, the volume increases. And we also, to meet up with all our customers' needs, we went nationwide chain. So once we have nationwide chain, and what we did was customer requesting for added services. And from a primary healthcare, one of the primary healthcare lab, we expanded to other primary healthcare services. And from there, we moved to secondary healthcare services. So we have, like primary healthcare, we have a medical laboratory, we have Lurvy pharmacy chain. Today, we have 50 outlets, we have online pharmacy and webcam, all kinds of things to meet current business trend, the youngsters, how to not doing the same old brick and mortar type of business. And we have online businesses, you can buy health packages, and it's 24 hours. And the trend is growing tremendously. And whatever I've done, as I said, my mentor, Tan Sri Dr. Jaga Disen, told me that, you know, the government, while he was still in service in those days, 20 over years ago, he said, remember, Beh, the law is catching up. They are going to have all the law and the act. So while I was given this type of tips, and while also serving my customer, I started all the accreditation, certification, and make things prepared for the law to come. So today, because of all this preparedness, today I have a complete primary care services. You know, we have lab, pharmacy, we have hearing, and we have dental and diagnostic clinics, and also I moved to secondary healthcare called the Specialist Medical Center that do all the specialist services, whole country.
Okay.
Yeah.
Well, I read on your website, you actually do Food and Industrial Testing Center. That's something you rarely come about. Can you maybe talk a little bit more about that?
Okay. While we are doing all these services like the primary healthcare and secondary healthcare, we have corporate clients like factories or importers. When they did request our services on medical examination for the staff for food handling and also the food material, if they are processor, factory processor or importer, then they need to do the testing for their food. And so we started the food testing nationwide, and we cover including Sabah, Sarawak, and besides only food, not only food testing, we also extend to environmental testing. We call BP environmental testing, where we do all the water testing, waste water testing. In fact, BP Healthcare today does all kinds of testing. It's a one-stop center, not only for human being, but for your food intake and also your excretion, all the pollution.
Yeah. Especially in future when laws and regulations come into place, especially when it comes to food, then that's when I guess business will be booming.
Right, so, like the RO testing, you know, for all this water testing.
Yeah. So earlier this year, in your chairman's statement message, you actually mentioned saying that we stand ready and determined to step up to the challenge to become an even bigger healthcare player, like sprinting up the rungs from a 7-Eleven store to a Walmart hypermarket in the healthcare industry. Can you elaborate a little bit more how from 7-Eleven you're going to be Walmart?
Okay. 7-Eleven is like you go to a 7-Eleven store. They don't give you a full complete range, but it can satisfy your immediate needs.
Yeah.
And BP, we are leaders in primary and secondary healthcare. This is equivalent to 7-Eleven. But to move into hypermarket at Walmart, then you need to have beyond that of the immediate service, that you need something like operation, room for patient to inpatient. So we are going to move into tertiary care. So if we have, as of today, for primary care and secondary health care, we are undisputable leader in Malaysia. And if my dream is to see this primary and secondary nationwide transform, upgrade to Walmart. Then we have a chain of hospital services. This number will be bigger than both KPJ and IHH combined together in Malaysia. That is my best dream.
That's your dream. So I understand that your company is not really listed yet. It's not public listed. How do you actually fund for your organic growth?
So far, with God's blessing, say whatever how smart you are, you really need God help. And in my case, so far, what I did was from my internal profit generating this fund to finance my growth. And also, the banks are very good. They are very supportive to my project, and I don't see any needs currently to go listing until such a time. I still got to leave. I'm the founder. I will leave it to my second generation. Whether they want to go listing or they don't want to go listing.
Yeah.
But definitely, my second generation are more aggressive than me.
Yeah.
Yeah.
Yeah. So, Dato Beh, you sound like a very savvy businessman. Apart from BP Healthcare, what other businesses do you do?
I'm also the founder of Pantai Hospital, Ipoh. And I have been with this company for 22 years until recently. IHH has already got listed.
Yeah.
And they requested me to sell them. And only recently I divest my interest in that company with a lot of sad feeling for you founded the company and it do so well.
Because it was your baby in a
Yes,
way.
yeah. And then another one project is Sunway City Ipoh, the 1,500 acre land, the total integrated city, township, which I'm also the founder, which I'm still holding the share. And they are still doing fairly well. And this project also almost 20 years. Yeah.
Okay, so you're doing a bit of property development too on top of just healthcare.
Yeah, they not only property, they have even hotels and things like that. Yeah.
Okay, interesting. So, well, in 2012, you actually had a partnership with Cipatra in Indonesia. Do you actually have any other expansion plan outside of Malaysia, or is it just going to be Indonesia and Malaysia main focus for?
Actually, for the expansion program beyond Malaysia, my second generation is heading this project. And we have decided that we are not going to go overseas to start a new setup again. It's too slow. So our decision, the family decision is whenever you want to go expansion, you acquire the group from other countries, and from there we scale them up. And it's faster because I started mine. Actually, I worked for my boss for 14 months and took over a company almost 34 years.
Yeah.
By many people's standard, it's too slow.
Yeah.
I'm still not a billion-dollar company, which is very slow. So I hope that my second generation, that they can scale it up from my 9-figure sales turnover to 10 figures or more. So by doing that, they have to do acquisition, and not organic growth.
Yeah.
Too slow.
So we'll be seeing a lot more acquisitions by BP Healthcare Group.
Yeah, they started. They already started acquiring.
I think you've bought Sime Darby Specialist Center in Taman Mega sometime in 2012. Any other newer upcoming deals going on for acquisitions?
My son has done. This year he done a few multi-million-dollar transaction, and of course he was the one also sold my stake in Pantai to IHH, and also buying of Sime Darby, Taman Mega, and and scale it up and do it up better, and the result is showing very good result from our BP branding injection and the way we do the things. And he also has in advanced stage talking and to acquire a few other hospitals, not only locally but overseas, because a lot of overseas investment banks also came to see us, you know, and wanting to fund us to grow.
So he's helping realize your dreams of having an end.
Not only my dream, the family dream.
Family dream. Yeah, that's quite true, because it's both you and your wife. So, Dato, apart from your businesses, how do you unwind? Because I'm sure someone as busy as you would still want to have other interests too.
Yeah. To stay healthy, I have to de-stress, and I pick up polo as my hobby and keeping me fit, you know, and because I'm working almost 365 days, and with this IT world, in this internet world, and you are working almost every day.
Yeah.
And it's like I don't know whether you call it sickness. Yeah, the machine, the computer is with you.
Yeah.
And you, and as a boss, you always want to give a quick turnaround time on your decision.
Yeah.
And with such type of lifestyle, 365 days, 24/7, you need something to unwind. So this polo sport makes me look, you know, not only feel good, and keep myself staying healthy.
Yeah, it's a very interesting way to unwind. Not something that a lot of Malaysians actually are into. But okay, thank you, Dato, for coming on our show. We have to take a quick commercial break right now. Okay, after the commercial break, we're going to have more headlines and also some corporate profiles to review. Stay tuned.
Thank you.
Nice.